compression in order to generate a dynamic score for venous clinical severity score, categorizing the scored individual, which adds emphasis to the most severe sequelae of the venous disease that are likely to show a greatest response to the therapy. This diagram illustrates the degree of, according to clinical presentation, for example, the presence of varicose vein ranging from absent, which is grade 0, to non or asymptomatic patient, grading from mild, moderate, or severe, grading from 0 up to grade 3. Few varicosities, isolated branch varices, or clusters include ankle flare or phleboctasia, and confined only to the calf or thigh, and also maybe involve the calf and thigh. The using of SEEP and venous clinical severity scoring has used to evaluate changes in patients of all SEEP clinical classes. Also, the usefulness of venous clinical severity scoring has been previously recognized in patients with moderate to severe chronic venous dysfunction, grading from C4 up to C6. For example, Michel et al. Evaluate venous clinical severity scoring system in the patients undergoing saphenous vein radiofrequency ablation. 499 patients and 692 limbs were scored by SEEP clinical classes and venous clinical scoring system before and after procedures. They conclude the venous clinical severity scoring grading 7. After treatment, scoring changes from the clinical SEEP2 to reach to the venous clinical scoring system, downgrading to B grade number 3. The second example, patient with active pigmentation, according to SEEP number 4 and venous clinical scoring system 16, 4 months after treatment, patients remain clinical SEEP4, but the total score of the venous clinical scoring system regressed to be 9. The example number 3, prior treatment clinical SEEP classification number 6 to be scored of the venous clinical scoring system 18, 1 month after treatment, clinically SEEP number 5 and venous clinical severity scoring regressed to be 11 degree. The last example, prior to treatment with SEEP classification number 6 to be venous clinical scoring system 21, 1 week after treatment, clinically SEEP to regress to be a grade number 5, while the venous clinical severity scoring regressed to be 11. And after 2 months later, clinically, SEEP classification reached to number 5, but the venous clinical severity scoring system regressed to be only 7 degree or 7 grades. In the end, the SEEP classification responds poorly to change of patients with clinically apparent varicosities and chronic venous dysfunction, while the venous clinical severity scoring responds to changes in the disease severity over the time and in response to treatment. In 2000, American Venous Forum developed the venous clinical severity scoring system, which was improvement over the original SEEP scoring system. And 2009, the revised venous clinical severity scoring was published, and it's currently used for documenting and evaluating the progression of the chronic venous dysfunction. Thank you.